WVTM 13 Project Community is highlighting barrier-breaking women. She grew up wanting to be an optometrist, but now she sees herself bridging gaps in our healthcare system.
WVTM 13's Carla Wade introduces you to a woman who's empowering seniors to take charge of their own well-being.
Shara Gibson was born and raised in Birmingham, and even though her career took her to other places, she jumped at the chance to come back home and be a part of helping care for community elders.
My name is Shara Gibson. I am a center manager for Archwell Health here in the Birmingham, Alabama area.
With more than 15 years of experience, Shara Gibson knows a thing or two about navigating the complexities of the healthcare system.
Healthcare has always been my passion.
Archwell Health Centers like this one provide primary care for seniors. Gibson oversees all the clinical and administrative operations here.
I think historically, healthcare, there's always been like access and equal healthcare, and questioning like, why can't I have access to quality healthcare? So being able to be a part of Archwell Health, where we're able to kind of bring a solution to a problem. And that's what I look at that as, where we're able to be right in the neighborhoods, right in the community.
They call the people they serve members instead of patients. And Gibson takes that familiarity a step further, seeing those members as extended family.
I look at each one as if they could have been my grandma. That's my auntie, my uncle. Like I truly have a family mindset when it comes to the care that we provide. So that's the way I look at it, and that's truly what inspires me day to day to do what I do.
The centers are strategically located in underserved communities, like here in Ensley and in Roebuck, where she grew up.
I went to North Roebuck, Smith and Huffman, so very familiar with the area.
Well, she does spend a lot of time in an office doing typical administrative tasks. A lot of her work takes her outside of it.
So we have chair exercise, health chats, ways to engage our seniors, and that's just beyond just taking care of them on the health component as far as doctor's visits. So we're able to engage with them on a social level as well. Teaching them how to use their blood pressure cuff and teaching them how to check their glucose levels and keeping them informed in the health chats that we have.
It's the kind of attention this doting mom believes would have helped her own family members, especially her beloved grandmother.
I think about my grandma. She passed away from Alzheimer's. So thinking if there was a model of care similar to this, where she was able to be educated more.
Gibson holds degrees in biology, chemistry, and respiratory health. But as a child, she dreamed of being an optometrist, but instead explored other avenues to working in the healthcare industry.
Did I ever see myself like on the management leadership side? Not so much, but now that I've been in it and doing it, it's been so rewarding. It's given me the opportunity to not only make an impact on the patients that we're serving, but also some of the team and people that fall up under me, being able to coach, develop, teach.
So now, instead of helping correct vision,
ultimately, when we talk about keeping our community healthy, making sure that we're providing great health care to our seniors is a big piece of that as well. We're serving grandmothers, aunts, uncles, people in our community, in our churches.
She's commanding a vision for the well-being of dozens of Central Alabama seniors every day. Carla Wade, WVTM 13.